Hi, I'm John Douglas, Chief of Business Development with CareSouth Carolina. As a member of our COVID-19 task force, I compile and update a data digest daily that is shared with the other task force members 7 days a week. Also, on a weekly basis, I prepare a weekly report that is shared with all CareSouth Carolina employees as well as the general public. I'd like to take a few minutes to highlight some key areas of the report, as well as to provide explanations on some of the information it contains. On page 1 of the report, the active cases reported by DHEC are listed by county in the PD, and then within each county by the zip code. There is a line for unknown or out of county zip code. Some zip codes extend from a surrounding county into another county, and any cases for those situations are listed there. At the top of this page is Chesterfield County, so let's look at that one. Within Chesterfield County, the first town listed is Shirong. This chart shows the town and the population and the number of active cases. The active cases are those within the 14-day quarantine window. There's 67 in the Shirong zip code, and this equates to 4.84 individuals being in the active 14-day window out of every 1,000 people in that zip code. You will also notice that some zip codes and towns are green and some are light red. These colors illustrate the zip codes where the number of active cases have increased from 1 week ago are in light red. Those in green, the number of active cases are either the same as a week ago or have decreased. County totals are given for each of the PD counties as well. In this case, Chesterfield County has 116 active cases, and that equates to 2.54 individuals out of every 1,000 residents. I believe that the active cases is a better indicator of the current state of the virus in our area versus total cases. Total cases will always increase. The active cases increase and decrease as folks recover or, unfortunately, as they die. On page 3 of the report, the counties are ranked by their active case rate. You see that Marlboro County has the highest rate in the PD at 3.52 out of every 1,000. Underneath the county rankings, the top 10 zip codes in the PD are ranked. And in this case, Clio in Marlboro County has the highest rate of 5.76 individuals out of every 1,000 residents. Beside those charts, the number of COVID-19 deaths are illustrated by county in our 5-county service area and the total for the entire service area. 6 deaths in Chesterfield County, 12 in Darlington County, 4 in Dillon, 14 in Lee, 3 in Marlboro, and 39 for the entire service area. Below this, also on page 3, is a graph showing the active cases in the service area by day from April 1st to present. You can see the steady increase for the service area. However, within our counties, the trends have not been as consistent, with earlier on Darlington and Lee counties having more active cases than the remaining counties, whereas most currently Chesterfield and Marlboro counties have the most active cases. On page 4, this is further illustrated by the active cases by weekly average in each of the 5 counties and the service area as a whole. It is clear that the service area as a whole has seen a steady increase, but when you look at each individual county, the story is very much different. Chesterfield and Marlboro both started with relatively low numbers and have spiked in the last couple of weeks. Darlington and Dillon and Lee depict a different scenario where their average weekly active cases have gone down in the last week and in some cases the last couple of weeks. Below this, we look at the total cumulative cases. And again, these are the numbers that you may see on TV or more often on TV because they make a better headline. These are the total cases, those who are considered active, those who have recovered, and unfortunately those who may have died. The numbers here are shown for each of our 5 counties as well as all counties contiguous to those 5 counties. This graph chart also shows the change from the previous week for each of these counties as well as both the states of South Carolina, North Carolina, as well as the United States and the entire world. Again, those shaded in light red show an increase from the previous week in the number of new cases, and those in light green either stay the same or have a decrease in the amount of new cases reported as compared to the previous week. There's also a column showing the number of cases per 1,000 population for each of these counties in both states, the United States, and the world. Then there's also a column showing if the rate for the counties exceeds their respective states' rate, whether each county's rate and the 2 states' rate exceeds the nation's rate, and then all counties and both states and the United States exceed the world rate. On page 5, there's a map of South Carolina which shows by county the cumulative infection rate. The darker blue the county, the higher the rate. As you can see, our service area is in the middle of the highest affected area in the state. In fact, out of South Carolina's 46 counties, Lee County ranks first, Marlboro County 5th, Dillon County 7th, Chesterfield County 9th, and Darlington County 11th. On page 6 is information from the Centers for Disease Control. This page shows the total cases in the United States and the total deaths, as well as a map showing the differences in the states in reported cases. On page 7, also from the CDC, is a graph showing the new cases by day, cases by age, and cases by race and ethnicity. On page 8 is the CDC national forecast and a forecast for the state of South Carolina. On page 9 is information from South Carolina's Department of Health and Environmental Control. The top of the page gives information on the number of tests that have been performed in South Carolina. Below that is a chart showing the new cases per day. And as you can see, the trend has been very much upward. Below is a projection by DHEC for the number of new cases for each week through June 27th. This graph shows that by the week of June 21st through June 27th, there will be an additional 3,239 cases confirmed in that week, as compared to the most recent completed week, which was the week ending June 6th, when 2,442 cases were confirmed. On page 10 begins the demographic data reported by DHEC. This information shows things such as the cases by age group, race and gender, and on page 12, DHEC reports hospitalization and recovery. The recovery rate in South Carolina, as of the last report, was 83%. DHEC also, on page 13, reports demographic data pertaining to deaths related to COVID-19, including by age group and race and gender. There are several different models that project COVID-19 into the future for South Carolina and even down to the county level. On page 15 is the COVID-19 projections model. This model, as of the weekly report for on June 9th, projected that there would be 1,790 deaths in South Carolina by September 1st. This model also projects the number that will be infected by COVID-19 going forward into the future. It projects the highest rate of current infections occurring in mid to late July. On page 16 is the U.S. interventions model from COVID Act Now. This model shows that South Carolina is at risk of an outbreak with an infection rate of 1.14, a positive test rate of 5.4, ICU headroom used at 19%, and contacts traced at 27%. These graphs show the information pertaining to the different data that the U.S. interventions model uses in its calculations. At the bottom of page 18, this model, taking all of this information into account, projects that based on current trends, 33% of South Carolinians will be or will have been infected with COVID-19 by September 4th, 2020, with a total of 7,000 deaths in the state. This model also provides us with county level projections. In Chesterfield County, the infection rate, which is the amount of people an infected individual is spreading the virus to, is 1.28. So for every person who is infected, they are on average infecting another 1.28 individuals. Chesterfield County is also at risk of an outbreak. And this model shows that, again, by September 4th, 2020, 67% of residents of Chesterfield County will be or will have been infected with COVID-19. The next county is Darlington, also at risk of an outbreak, with an infection rate of 1.12. The model is projecting that a much lower percentage of Darlington County residents will be or will have been infected. The rate for Darlington County is 27% as compared to Chesterfield County's 67%. For Dillon County, there is insufficient data for them to provide a full analysis. However, they do show that based on current trends, 35% of Dillon County residents will be or will have been infected by September 4th. In Lee County, the infection rate is 1.08, and the model projects that 29% of Lee County residents will be or will have been infected by September 4th. Finally, in Marlboro County, the infection rate is 1.3, and the model shows that based on current trends, 63% of Marlboro County residents will be or will have been infected by September 4th. Another model is the IHME model. This is a model that DHEC also posts on their website, and it is projecting by August 4th there would be a total of 841 deaths in South Carolina. There's a great variance between the models. Remember, the U.S. interventions model showed 7,000 deaths in South Carolina by September. This model is showing 841 by August 4th. The model shows things such as daily deaths, daily infections and testing, hospital usage, and social distancing. On page 26, this shows the infection rate for each state in the nation and for South Carolina specifically. Important to note that South Carolina, as of the date of this report, had the highest infection rate in the United States at 1.12. On page 27 is the National Social Distancing Scoreboard. This looks at how much the residents of each state and each county within each state are practicing social distancing. For our counties, Chesterfield County scores a D-, Darlington an F, Dillon an F, Lee a D, Marlboro a C-, with both South Carolina and the United States scoring an F. Finally, on page 28, we look at testing per 1 million population. South Carolina, North Carolina, and Georgia are listed, as well as the United States. South Carolina ranks 39th, North Carolina 37th, and Georgia 26th out of the 50 states. The United States ranks 30th out of all reporting governments in the world. Lastly, change in South Carolina healthcare activity. This graph looks at the change in healthcare activity in 2020 as compared to the same time in 2019. As you can see, healthcare activity was down, and down as much as 60% in early May. However, by around May 25th, activity in South Carolina went from being down to being up, and up as high as 50%. This weekly report is released each Tuesday by email to all CareSouth Carolina employees and via Facebook for the general public. If you have any questions or desire additional information, please do not hesitate to call. Remember, stay safe and stay CareSouth Carolina strong.